Estradiol 14 micrograms per 24-hour weekly transdermal patch is a medication that contains estrogen hormone. It is mainly used by women after menopause to prevent bone loss, also known as osteoporosis. However, it is important to note that there are other medications, such as raloxifene and bisphosphonates including alendronate, which are also effective in preventing bone loss and may be considered safer options. It is recommended to consider these alternative medications before starting estrogen treatment. The recommended dosage for the transdermal patch is to apply one patch once a week. It is best to apply the patch on the same day each week at a time that is convenient for you. Always follow the instructions provided by your healthcare provider for the best results. Before using this medication, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, consult your doctor or pharmacist for more information. To apply the patch, peel off the backing and place it on a clean, dry area of the lower stomach. Press the patch firmly for about 10 seconds to ensure it stays in place. Avoid applying the patch on the breast or on oily, broken, or irritated skin. Also, avoid areas where the patch might easily be rubbed off, such as the waistline. This medication is usually worn for 1 week and then replaced according to your doctor's instructions. When replacing the patch, apply it to a different area and wait at least 1 week before using the same area again. To dispose of the old patch, fold it in half with the sticky side together and throw it away in the trash, keeping it away from children and pets. Do not flush the patch down the toilet. If the patch falls off, reapply it to a different area. If it does not stick completely, apply a new patch and wear it for the rest of the 7-day period. Avoid wearing 2 patches at the same time. Use this medication regularly to receive the most benefit from it. To help you remember, change the patch on the same day each week. You may find it helpful to mark your calendar with a reminder. Some common side effects of the Estradiol 14 mcg/24 hr weekly transdermal patch include skin redness/irritation at the application site, nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, severe abdominal pain, or swelling of the hands/ankles/feet. Additionally, this medication may rarely cause serious problems such as blood clots. It's important to seek medical help immediately if you experience symptoms such as chest pain, sudden/severe headache, weakness on one side of the body, or trouble breathing. In the case of a serious allergic reaction to this product, seek immediate medical help if you notice symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Estrogens, whether used alone or with another hormone, can rarely cause serious side effects. It's important to discuss the risks and benefits of hormone treatment with your doctor. Estrogens should not be used to prevent heart disease or dementia. Estrogens can increase the risk of cancer of the uterus. Taking a progestin as directed by your doctor can help decrease this risk. If you experience any unusual vaginal bleeding, be sure to tell your doctor right away. In postmenopausal women, estrogens, taken with or without a progestin, can increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used along with a progestin, estrogens can also increase the risk of heart disease, such as heart attacks. The risk for serious side effects may depend on the dose of estrogen and how long it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Make sure to discuss the use of this medication with your doctor regularly, for example, every 3 to 6 months, to determine if you still need to use it. If you will be using this medication long-term, you should have regular complete physical exams, for example, once a year, as directed by your doctor. See also Notes section. Before using estradiol, make sure to inform your doctor or pharmacist if you have any allergies. This patch may contain inactive ingredients that could cause allergic reactions or other issues. Also, let your doctor or pharmacist know about your medical history, especially if you have a history of certain cancers, blood clots, stroke, heart disease, liver or kidney disease, high blood pressure, diabetes, obesity, or mental/mood disorders. If you smoke, it's important to note that using this patch while smoking can increase your risk of stroke, blood clots, high blood pressure, and heart attack, especially if you are over 35 years old. This medication may cause dark areas on your face and skin when exposed to sunlight. So, it's best to limit your sun exposure and use sunscreen when outdoors. If you wear contact lenses, be aware that this medication may cause vision problems or difficulty wearing your contacts. Also, let your doctor know if you will be having surgery or will be immobile for a long period, as these conditions can increase your risk of blood clots. It's important to note that children may be more sensitive to the side effects of this drug, so it's crucial to discuss any potential effects with the doctor if the medication is prescribed for a child. Lastly, if you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware of potential drug interactions with estradiol 14 mcg/24 hr weekly transdermal patch, as they may change how your medications work or increase your risk for serious side effects. This includes aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. It's important to note that this medication patch should not be chewed or swallowed. If someone accidentally overdoses on the medication, it's important to remove the patch if possible. For serious symptoms such as passing out or difficulty breathing, it's crucial to seek immediate medical help by calling 911. If the overdose is not severe, it's still important to contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. While using this medication, it's crucial to have regular physical exams and medical tests. These may include blood pressure checks, breast exams, mammograms, pelvic exams, and pap smears. Your doctor will provide instructions for examining your breasts, and it's important to report any lumps right away. Be sure to attend all medical and lab appointments for proper monitoring. To promote healthy bones, consider increasing weight-bearing exercise, quitting smoking, limiting alcohol consumption, and eating well-balanced meals that contain enough calcium and vitamin D. Your doctor may also recommend calcium and vitamin D supplements and lifestyle changes, so be sure to consult them for specific advice. Taking steps to prevent or control high blood pressure, high cholesterol, and diabetes can help reduce your risk of heart disease and stroke. Lifestyle changes such as managing stress, following a low-fat and low-salt diet, maintaining a healthy weight, regular exercise, and quitting smoking can all help. Keeping your mind active with mental exercises like reading and solving crossword puzzles may also help prevent dementia. Talk to your doctor about any lifestyle changes that might benefit you. If you forget to replace a patch at the scheduled time, replace it as soon as you remember. Do not use more than one patch at a time. It's important to remember to replace the patch at the scheduled time each week. If you forget, replace it as soon as you remember. It's also important to only use one patch at a time. This will ensure that you are getting the correct dosage of the medication. Remembering to take your medication as directed will help you experience the full benefits of this medication. When it comes to storing the estradiol 14 mcg/24 hr weekly transdermal patch, make sure to keep it at room temperature. It's important to not remove the patch from the pouch until you're ready to use it. And, of course, always keep all medications out of reach of children and pets. And when it comes to disposing of the patch, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product once it has expired or is no longer needed, as outlined in the How to Use section. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.